Module Overview. Nutrition, hydration, and hygiene are cornerstones of health and dignity for people living with dementia. This module explores the interconnected role of proper dietary intake, fluid balance, and hygienic routines in supporting physical health, emotional stability, and behavioral control in dementia care. You will acquire deep understanding of age-related changes in eating habits, sensory decline, oral care, continence support, bathing practices, and how cognitive deterioration impacts basic self-care abilities. This module also guides caregivers in identifying malnutrition, dehydration, and neglect risks, adapting meals and hygiene routines to individual preferences and abilities, and promoting compassionate personal care that protects both physical and emotional well-being. By learning to integrate person-centered approaches into ADL, activities of daily living support, caregivers empower persons with dementia to maintain independence, comfort, dignity, and quality of life. Learning objectives. By the end of this module, you will be able to explain how dementia affects appetite, thirst, eating behavior, and personal hygiene. Identify signs of dehydration, malnutrition, and hygiene neglect. Support safe feeding, oral health, toileting, grooming, and bathing routines. Apply strategies to adapt food, fluid, and hygiene tasks based on disease progression. Recognize the emotional, cultural, and psychological significance of cleanliness and grooming. Assist with activities of daily living while protecting dignity and autonomy. Document nutrition and hygiene-related concerns accurately and ethically. Nutrition in dementia care. How dementia impacts. Eating. Forgetfulness. They may forget to eat or that they've eaten. Taste and smell. Loss. Reduced interest in food or strange cravings. Swallowing difficulties. Dysphagia. Increased choking risks. Behavioral disruptions. Pacing. Wandering during meals. Visual perceptual issues. Not recognizing food or utensils. Delusions. Belief that food is poisoned or inedible. Malnutrition. Causes and risks. Cause-effect. Poor appetite. Weight loss. Weakness. Medication. Side effects. Nausea. Dry mouth depression. Refusal to eat. Ill-fitting dentures. Pain during eating. Lack of assistance. Meals. Left untouched. Signs of malnutrition. Sudden weight loss. Loose clothing. Fatigue. Irritability. Pressure sores. Weakened immunity. Hydration needs and challenges. Water is often forgotten in dementia care. Dehydration can mimic or worsen symptoms like confusion, aggression, constipation, and urinary tract infections, UTIs. Dehydration warning signs: dry lips, sunken eyes, reduced urine output or dark urine, dizziness or fainting headache, and agitation, increased confusion. Hydration. Tips: offer small sips throughout the day. Don't wait for "I'm thirsty." Use bright colored cups for better visibility. Avoid caffeine and alcohol. Offer high water content foods: melon, soup, cucumbers. Personal hygiene in dementia care. Maintaining hygiene promotes self-respect, prevents infections, and enhances mental well-being. However, individuals with dementia may resist bathing due to fear or confusion, forget how to use soap or towels, feel embarrassed or threatened by help with private areas, fear water or cold sensations, lose sense of time, e.g., don't remember when last bathed. Daily hygiene components. Task considerations. Bathing use, calm voice, provide choices, ensure privacy. Oral care, monitor brushing, check for sores or loose teeth. Hair care, use gentle combs, familiar styles, shaving. Be cautious with razors, use electric if possible. Nail care, trim gently to avoid scratches, / infection. Foot care, look for sores, swelling, poor circulation. Toileting and continence support. As dementia progresses, continence may decline. Addressing this requires tact, skill, and routine. Strategies: establish regular toileting schedules, use signage and colors for bathroom recognition, provide adaptive clothing, elastic waists, Velcro. Avoid shaming. Respond calmly to accidents. Monitor UTI symptoms or constipation. Promoting independence and dignity. Let individuals do as much as possible, even if imperfectly used. Prompts, hand-over-hand support, or demonstration. Preserve privacy, e.g., cover with towels during bathing. Celebrate participation, not perfection. Document preferences, e.g., she prefers lavender-scented soap. Documentation and ethical considerations. Document food fluid intake, refusals, or patterns. Weight changes. Signs of poor hygiene. Swallowing issues or choking events. Reactions to hygiene routines. Use objective, respectful language. Client refused breakfast. Offered toast and porridge at 9:15 a.m. Accepted toast. Fluids encouraged. Professional insight. Cleanliness and nourishment are deeply tied to identity and cultural values. Even when memory fades, the sensation of being clean, well-fed, and comfortable remains powerful. Neglect in these areas can accelerate decline and damage trust in caregivers.